Everyone hear me, please. All right. I can see Oya says he can't hear me. Can others hear me as well? Okay. All right. So we'll be starting now, and then more people will join as we go on. So we'll just start with a brief introduction of everyone present. So we'll start and then end with our guest, Dr. Abioye, after which the session is going to start with him telling us about his career journey so far and how he got into the PhD journey and academia in general. And then we'll go on to a question and answer section and then we'll close for the day. So we anticipate that this should take just about an hour. So yeah, we'll start first with myself. I am Olakumi Ogoyemi. Um, I started DWS with Christian Oyo. That's Oyo. The idea behind DWS is really just to shed more light on other things that doctors can do with their medical degree beyond just going into residency, which is what typically most of us are aware of from school. So since we started, we've had people from various fields, and hopefully we would have more people come on in the future. With that, I'll go on to Femi Talabi. Can you please introduce yourself just briefly, your name, and just one or two sentences about yourself, and then we'll move on. Femi. I'm not certain if Femi is on, so I think we'll just move on to Ibrahim Yekini.
Yeah, so my name is Ibrahim. Graduated from med school about 6 years ago now. So I'm currently working in biotechnology, biomedical engineering.
All right, thank you, Ibrahim. Then we'll move on to Oyo.
Hi everyone, good afternoon. My name is Dr. Kunko Oyo. Graduated med school just 3 years ago. I'm currently working in a health tech company, like straddling the thin line between still being in the clinical sector and also doing non-clinical work as well.
All right, thank you, Oyo. Tosin, can you please introduce yourself?
Hi everybody, my name is Tosin. I graduated med school 3 years ago. I'm presently working in the clinical setting though, but I have interest in something non-clinical, which is one of the reasons why I'm joining today's session to also learn more. Thank you.
Thank you, Tosin. I think with that, we'll go on to Dr. Abioye, and more people would join as we go along. I think at registration we had over like 25 people or thereabouts, but then I understand how these things go. So hopefully more people will join us as we go on. And this is also being recorded, so we'll upload it on the YouTube page at the end of this session. So Dr. Abioye, please.
Sorry, I was muted. Hi everyone. It's a pleasure to be here. Thank you very much, Komi, for putting this together. I'm excited to meet all of you. I think that I know a lot of the faces that are staring back at me here today. We haven't spoken before, but I guess this is a good opportunity to get the conversation started. So I am Ibrahim Abioye. I graduated from med school in Lagos in 2009 January. Yeah, and since then I have had what you would mostly call a typical doctor without stats career. To be honest, I have had um, I've worked in non-clinical practice probably since 2011. Since 2011 August, that was probably the last time I saw patients, and in all of that time, I have worked in research, and that research has kind of spanned across clinical medicine, academic medicine, and now industry. I'm finalizing my PhD as well. So I think I've had the opportunity to work across a breadth of fields and who knows what else there is out there. I am continuing to be open to diversifying my experiences. I think the fundamental thing about how I define myself is that I am a researcher, and I like to then take that background in clinical medicine and research and then take it into whatever excites me. Since completing med school in 2009, as I mentioned, I NYC house job NYC did the works, and then I did an MPH at Harvard in 2011, 2012, and then I joined this research group that I still am part of, to be honest. It's a research group that does research into global health, epidemiology, and nutrition. It's sort of like at that intersection. And at that time, I followed basically an opportunity where that research group had an opening in a clinical trial. So they had a clinical trial in Tanzania that the person who was managing was leaving, and they had an opening, and I'd been speaking to one of my professors about opportunities in research, and he said, hey, would you like to go to Tanzania? And so I said, huh. It wasn't definitely what I was thinking. At that point in time, I thought that I would be a clinician. I didn't start out my career thinking I'm just going to be this guy who does public health research for a living, so to speak. I thought that I would be a clinician. I thought that I will probably be a surgeon and also do a PhD in epidemiology or health policy, and then have a sort of mixed career. So I've always sort of wanted to do a lot of research, but I didn't plan that it was going to be the main focus of my career. Yeah, so that sort of evolved. So I took on that opportunity in Tanzania, and then so that meant that I left the US, and I was sort of disconnected from the typical path of where I was going to be able to write the USMLEs and all that. And I basically started devoting myself to public health research. I thought I would do that for 1 to 2 years and then leave. But then I enjoyed it so much, and I spent a few more years in Tanzania. I spent 4 years, I think, in all, before coming back to the US. And then basically I came back to the US because I thought, okay, now this is the time to move forward to whatever the next stage is. So in Tanzania, I had the opportunity to sort of lead the field operations for many large clinical trials. As it turned out, the clinical trial that I was jumping on was wrapping up, but then there were new studies that I was then able to take the lead on. And so I ended up taking the lead on, I think, about 4 randomized control trials, large trials where we had 50 to 60 staff were enrolling patients that were thousands. One of the trials had 4,000 patients. That's sort of like the typical ballpark. There were pregnant women, HIV positive adults, who were then followed up for multiple years. But our intervention of interest were nutritional interventions, were micronutrient supplements. So it sort of like would resemble the typical randomized control trial you would find in like a pharma setting, except that we're administering nutritional interventions. So I did that for some time, and I liked it, but I think that before that, I had this internship in Ghana where I'd spent 1 month sitting at the desk and analyzing data, and I really like that too. So I'm basically taking together all of these strands of my experiences and bringing them together and trying to figure out what next. But I also realized that beyond the first few months of living clinical medicine, I didn't really miss it. You know, I always wanted to be a clinician because it made sense. It was the thing that you were expected to do. And I wanted to be a surgeon because I knew surgery, and I thought surgery was cool. I liked the surgeons in my hospital, in my med school. They were reputable. People thought that they were highly respected. I didn't have those kind of role models in public health, to be honest. That I would say that, but I really looked up to this person. I wanted to be like them. I ended up in clinical medicine because in public health because I was pursuing opportunities and also because I identified gaps in my learning. So I like to do research, but I always thought that I would do research that was more clinical, population based, but it would be clinical research, so to speak. And I started to dabble into research basically all of my career. So my first real exposure to research was as part of my med school project. So that med school project, I really went hard. I did a thesis that I ended up publishing two papers from, one of them in an international journal. So I kind of knew that I enjoyed that process of collecting data, figuring out research questions, analyzing, presenting them to academic audiences. So I sort of like that. So I knew that I was going to have that, even if I was going to be a clinician. And then but then I then pursued the opportunity. So I think that's one of the things in life is that many of us tend to be idealistic about where we want to go. So I think one of the things about academic research, okay, so I'm being told that my voice is a little distant. I think I can transition to a different device and then we'll try that. Sorry about this.
Is this good?
It's
Can
better
you let
now.
me know?
Yes, it's
Okay,
better
this
now.
is good. Okay, all right. So I always knew that I wanted to do research, but I thought I would do it in the context of clinical medicine. But the opportunities that I got led me to, there's typically the the balance we're trying to make between the idealistic, this is who I want to be, versus these are the opportunities that I'm getting, and then what am I doing with them? So that's basically how I spent the first few years of my career, and then I then decided that I was going to come back to the US because I was basically tired of being in Tanzania. To be honest, I thought that I was beginning to not move forward the way that I would like. So I think it's always important at every point in time, every couple years, to reevaluate yourself and ask yourself, where am I going? What am I doing? Am I where I want to be? And then move forward. So I then thought that I would apply to a PhD. So the first time that I did apply to a PhD was immediately I finished my MPH in 2012. I didn't fully understand the process and I didn't get in. Also, I didn't apply to many schools. I kind of thought that I would apply to Harvard alone. I had just finished a degree from Harvard and I would apply and I would get in. But I did not. So that's when I then ended up doing the public health research work. So 3 years or 4 years down the line, I thought I would evaluate as I was evaluating my options, I then thought that a PhD might make more sense now. And that's how I started to explore a PhD. So when I applied to the PhD again that year in 2015, I didn't get in still. By that time, I had a number of papers, but I was still only applying to Harvard. And I wasn't writing my statement of purpose in a way that really fit, it wasn't really a fit for the program. I didn't fully understand the application process. And at that point in time, I think I was allowing other people to guide my application materials too much. I wasn't bringing myself to the application, So the subsequent year, I decided that I'll just do a lot of introspection, do research to understand what the program really wants, but also apply to multiple places. So this time around, I applied to about 4 schools, and I got offers to most of them, but I then got an offer to Harvard, and then I started this PhD at Harvard. But in reality, the research that I do is basically the same research that I have been doing since 2012 when I joined that research group. Basically, the offer that got me to join the research group was simple. It was this. Somebody told me that this research question is interesting, read about it. And I basically got swept up into the research question itself. I thought it was intriguing, and I thought it was intriguing. And so that's the same research question that I have continued to explore in more depth, even now, and that's essentially the interaction of iron, infections, and nutrition. Should we give iron to people who have infectious disease? If we do, how should we manage it? What are the implications for anemia? What are the implications for their overall health? What infectious diseases matter? Should it be malaria? Is HIV different? And that's really how I basically found the question that I've sort of devoted my research career around. And that's what my PhD centers around as well. So that's been my career journey. I'm at this point today now where I've been in this PhD program. This is my 4th year, and I'm hoping to wrap up in the next month. But also, during the PhD, I started to rethink everything that I had been doing over the last decade or so. And I came to the point where my motivations are becoming different. Previously, I was motivated by just interest in an intriguing research question. But now I have kids, I have a family that I have to take care of. And I think that financial motivations have become even more important to me. But the other thing that has become more important to me is that academic medicine, I'm quickly realizing, does not have as much opportunities. Maybe not academic medicine, I should say academia, does not have as much opportunities as I would like if you're not seeing patients. In the US, in many places, there is sort of like, it's not a ceiling per se, it's that there are few spaces. If you don't want to go to 2nd tier schools, if you want to stay at the 1st tier schools, there's few spaces, and so you either wait in line or you leave and go do something else. So I kind of realized that very early, and I started to ask myself, why should I wait in line, so to speak, for a career where I'm not going to be as well paid as I think I should be, when there are alternative careers that I should be pursuing that will give me as much pay, and I can craft a totally different career that you might not see it out, it might be different from everything else that you have seen, but it will get me where I need to be. So I started to check out industry, and I started to check out big pharma. And so today I currently have a role as an associate director in a pharmaceutical company. So I think that's where I'm going to be spending the next couple of years of my career, and and basically the way that I've come to that decision is this. In 2018, I applied to an internship at a pharma company, and I spent 1 year at that pharma company doing epidemiology, basically the kind of things that I already have experience doing, but also some things that I didn't really have experience doing, like health economics, outcomes research. And so I started to explore that entire different career path. I thought, put yourself out there, check out stuff. I thought that I will try pharma, I will try devices, I will try tech, and then eventually make a decision. But then when I realized very quickly in getting to pharma that it's kind of sort of closest to clinical medicine. It pays well. The careers are fairly steady. There are people who have been at these roles for decades and who do well. They're experts, they're smart, they're kind people. It's a great working environment, as opposed to like working in academia that's more often cutthroat, where you're fighting for grants all the time. Here also, you're on your feet, you're moving. You have to deliver projects, studies, research. You can't just sit. It's not as if this is a space where it's not a cushy role, but it's academic. It's as academic research as academic research goes. It's also a lot of project management, which is a piece of research that I came to really enjoy when I was in Tanzania leading studies. So there's that as well. So it gives me everything else that I want, and then it gives me better pay than what my professors at top tier universities are going to get, or maybe as much as my professors at top tier universities. So I was like, this is not a hard decision to make. And so I transitioned again. So I'm basically in the middle of a transition as it is now. I've spent my first year, and I'm in a role now that I think I really enjoy, and I'm looking forward to like what the future holds. So this has basically been my career journey. It's starting just as any other Nigerian doctor would have started, house job in Lasso, NYC, and then an MPH, and then and now a PhD, but also field research doing global health work, and now doing global health work in the context of evidence development, but in industry. I'll take any questions that you might have, but I'm happy to elaborate further.
All right, thank you so much, Dr. Abioye. That was I think it was quite detailed explanation of your journey so far, and also like taking us into like where you are currently. Well, we're going into the question and answer section next. However, time on this session is running out. I think in about 2 minutes. So I would just like to let everybody know that when we probably do get logged out, please let's rejoin using the same link that we used to join the session at the beginning. So it just brings us back here. I think maybe we could just wait for this to run out, and then we start the question and answer section once we start the new session. I don't know. I think that makes more sense. Is any other person in agreement with me?
I think we can just end this and join
Okay.
again.
I'll rejoin.
So
Yeah.
All right. So I'm going to end this now, and then we join again. All right.
Okay.
Thank you.
Thank you.